Hello, my name is Jennifer, and I'm here to advocate for an increase in physical activity at the workplace. Rising non communicable diseases, physical inactivity. According to World Health Organization, one of the 10 threats to global health in 2019 is the rising problem of non communicable diseases. Per their research, chronic diseases such as heart disease, diabetes, and cancer comprise of more than 70% of all deaths in the world, or 41 million people, including 15 million people dying prematurely between the age of 30 and 69. Over 85% of these reported deaths are in low and middle income countries. WHO names 5 major factors causing the diseases: tobacco use, physical inactivity, harmful use of alcohol, unhealthy diets, and pollution. WHO states the risk factors are linked to mental health problems starting at the age of 14, with most cases undetected and untreated, with suicide being the second leading cause of death among 15 to 19-year-olds. In support of WHO's aim to meet global target of reducing physical inactivity by 15% by 2030, the proposed policy advocates for an increase in physical activity at the workplace. The rising instances of chronic diseases affects many who work sedentary jobs such as computer technology professions, administrative jobs, healthcare, professional and government services, just to name a few. Parry and Straker 2013 defines sedentary activity as activities using an energy measurement of only 1.5 metabolic equivalent while sitting or reclining. Sedentary activities involve sitting prolonged periods of time with little to very minimal walking, standing, or lifting. Parry and Straker 2013 add that these behaviors are emerging as an important risk factor for poor health and mortality. I'm here to advocate for an alternative, healthier condition at the workplace, aiming for a change in the specialty pharmacy group work environment as well as the workspace for many jobs mentioned above. Who does this health issue affect? This health issue affects majority of workers from age 18 to 65 and beyond, with sedentary jobs mentioned. It also affects children and young adults who are not physically active, copying the habits of the parents. What is the impact of this health issue on the community? Inactivity or not enough physical activity makes people prone to chronic ailments such as cardiovascular diseases, adult onset diabetes, mental health problems, obesity, hypertension, among many other health conditions, which may also lead to cancer. The more health issues the community face, the less productive and functional it is to support growth, causing a financial burden to neighboring communities, the nation, and the world. The more of these health conditions that remain unaddressed, the more the society suffers from non-productive lifestyle and bigger allocation of federal and state budget towards healthcare spending for treatment of these preventable chronic diseases. The increase in chronic diseases must be addressed at the level where many affected can be helped, such as the workplace, because the majority of waking hours are spent at work. These diseases are preventable with the right amount of diet and exercise. What better way to get the government involved than creating a policy or legislation that encourage employers to invest in their employees' health at the workplace? This policy advocates for people to be active and move a little bit more at the office. An initiative towards healthy environment is an investment into the lives of people. The more active the people, the greater the tendency for happier and more productive employees. The proposal is for employers to allocate budget towards office items or gadgets that allow greater mobility. For example, a desk that can be raised up and down will allow people the opportunity to stand up more rather than sit all day. The policy requires building in-house gym with equipment for walking, running, biking, lifting weights, and aerobic group exercises at a minimal to no cost to employees. It requires building sidewalks with trees and plants for employees to be encouraged to spend time outdoors walking during breaks and lunch breaks away from desk. Employees spend 8 hours or more of their time each day, 5 to 7 days a week at the workplace. Employers will gain loyal, productive, and positive employees when an investment of this level is provided. It not only fosters healthy lifestyle but happy people. The policy will affect not only the employees but the employers and family members who will find their families having more time and energy to spend with them when they reach home. The proposal targets all employees from age 18 to 65 and beyond. It encourages people to participate in their well-being by increasing physical activities at the workplace. Increased physical activity will result in better living conditions with less tendency of acquiring chronic ailments. Promoting options to increase physical activities will ensure people working in jobs that are sedentary will have an option to move more for the sake of improving health. The number of working population suffering from chronic diseases is expected to decrease. At the same time, money allocated for healthcare use will be freed to give back to the employers or subsidized for gym use and group classes. The cost to implement will be the upfront cost of convertible desk for each employee, the cost of in-house gym with equipment and health coaches for group activities and exercises, and the cost to build walkways with trees and plants outside the facility to allow for outdoor walking away from desks. The benefits are increased physical activity, decreased risk of chronic ailments, happier, healthier people who can be more productive. The risk for enacting the policy is the opposition group who will not see the benefit but will misunderstand the purpose and claim too much government intervention in the lives of people, possible workplace accidents from improper utilization of equipment, and possible injuries from group activities. The risk for not enacting the policy is rising healthcare concerns related to inactivity, as affirmed by WHO, more sickly, less productive, and increased healthcare-related expenditures, more government budget allocated for healthcare expenses, and no alternative at the workplace to combat preventative chronic diseases that are problematic in the United States and around the globe. How will the lives of people who are affected by the health issue change if this policy is enacted? Incorporating physical activity as an option during workday will promote healthier lifestyle and the risk of preventable non-communicable diseases lowered. The conservative political circle will weigh the cost of all the changes and benefits to many, vote to changing the norm and advocate for business change and provide the necessary amenities for the employees. The moderate group may weigh in the benefits versus costs and the benefit to the business, then decide, but it may rely on upfront costs to fully support. The liberal group may find the individual employee benefit good, but government involvement in enacting a policy to mandate the change may be problematic. They may see the benefits to pharmaceutical agencies diminishing, and the progressive political view will support the advocacy because it is an improvement towards social reform, an improvement in technology, and an improvement of the human condition. The changes to workplace have the potential to physically change the lifestyle and empower many employees. The most important message that legislators need to hear is that change from sedentary living condition at work causing chronic ailments must be stopped. Allowing an opportunity for a better alternative is the responsibility of those who have the power to do so. This policy will improve the outlook of many lives, reduce healthcare expenditures related to treatment of preventable diseases, and it will promote the well-being of many workers and influence the lives of families. Constituents of the legislators voting for this policy should feel proud of the policy and encourage its completion. The World Health Organization's data at the beginning should compel legislatures to support the policy as it involves the lives of many, not only in the United States but around the globe. Resources are limited to address all sectors of society by changing the environment. But changing the environment at the workplace is something that can be done. But change must first take place here to encourage the other countries to follow suit. Thank you.